All right, you can walk in now. Hi, patient. Good evening, Natalie. Nice to see you. Welcome to my clinic. My name is Tina Nordine, and I'm going to be your nurse practitioner student today to do your assessment on your head, ears, neck, throat, mouth. And your name is Natalie Nordine. You're 17 years old, and I just wanted to let you know I'm actually your mother, so I'm giving consent to allow you to do this assessment today. Do you agree to do this assessment today?
Yes, ma'am.
Maybe not so much of a willing participant, but you're doing it to help mother out. Is that correct?
Yes, ma'am.
Okay, very good. I'm going to be videotaping this video, and my instructor will be video or viewing that video. So don't worry about anything, okay? All right, so today, Natalie, other than coming in for your assessment, is there anything else that you'd like to share? Any chief complaints that you'd like to share that you might have today?
No, ma'am.
No, ma'am. Okay, very good. So, Natalie, I've on the floor, as you can see, there's a tape right here and one right there. I don't know if you can see that in the video, but just so you can know that in just a little bit, that's going to become important when I test your eyesight, okay? That is exactly 6 feet apart, and when I do your eyesight test, we're going to make sure that you stand 6 feet away from me when we look at that, okay? So just kind of giving you an idea as to what's going on in our clinic today. All right, so I've got a few items over here that we're going to be using, some instruments and stuff that are over here on my exam table, and I will be explaining each of those to you prior to utilizing them. I'm going to check the video just to make sure that it is running, since we don't have a videographer this evening, just to make sure everything's going well. So let me check that real quick. Okay, it looks like you're in a good area. And Natalie, first what we're going to do is I'm going to look at your head, and I'm going to inspect your hair. I'm going to look at the texture of your hair and the distribution of your hair, and it looks like you've got beautiful hair. Very nice. I'm making sure that also now I'm going to palpate your scalp, and when I do that, palpate means touch, to feel, okay? And when I'm doing that, I am feeling on your scalp, around your scalp, to see if there's any bumps, bruises, lesions. Are you having any pain at all? Anywhere? All right, it looks like everything is very normal. Looks very good. Let me just check to see if there's anything else I need to check for you. Have you had any head trauma or any issues with your head at all?
Yes.
You have? Okay, can you share with me a little bit about that?
I had 2 concussions.
2 concussions. I know based on your history and physical that we did that you are very much involved in lots of sports. So tell me about your concussions. Do you remember those?
Yes, I got knocked out in soccer 2 years ago, and then last year my flyer fell on top of my head and her teeth bit into my skull.
Ouch. I bet, here I am showing you a little empathy. I bet that was quite frustrating. And I also think I remember you telling me you had to sit out a couple of games too, so that can be quite frustrating, especially with you being the captain of the cheer squad and being a leader. That's taking you out of the game can be quite frustrating. So I hate that for you. I hope that things are going well now. And are you having any headaches or any problems from that? Any type of symptoms that you're seeing? No. Okay. I'm going to grab one of my instruments and bring that over to you, because the next section here is to check your, I'm sorry, I have a couple of other things I forgot to check. So I want to check your temporal pulse, and while I'm doing that, I'm checking your temporal artery here, and then I'm going to move down here to you've probably heard before, TMJ, temporal mandibular joint. So what I'm going to do is I'm going to feel here. I'm going to ask you to open your mouth and close your mouth, and I'm looking to see if there's any, and open your mouth and kind of go side to side a little bit. Okay, and are you having any pain or any clicking or anything like that? So it looks like your TMJ, your temporal mandibular joint, is intact, and it is normal. So very good. So my apologies that I had forgotten to do that, but want to make sure that I check everything that we needed to check. I want to make sure that I'm looking at your sinuses as well. I know this time of year, there's a lot of people with allergies. We live here in the South, and there's lots of pollens and different allergies. And so you want to check your sinuses to see if there's any pain or pressure. So what I'm going to do is I'm going to check your frontal sinuses. And if you'll tell me if there's any pain or pressure here, and your maxillary and frontal sinuses. Do you feel any pain or pressure in that area? No. Okay, very good. I'm glad to hear that. Okay, so the next thing is I do want to check, oh, and also I made sure that there was symmetry on either side. You have symmetry throughout your skull and your head as well. Either side is equal. And then as I'm looking at you, facial features as well. All of your facial features are equal. I've looked at your eyebrows, your eyes, your eyelids, your nose, septum, and all of that looks very good and symmetrical. All right, so the next thing is looking at your eyes. And when I do that, I'm going to be looking for any type of conjunctivitis, any type of discoloration in your pupils. I'm going to pull your eyelids down here gently, just to look underneath. And I see pink, which is not redness, but pink, and there's no discharge, there's no liquids or any discharge coming from your eyes. Your corneas look good, your eyelids look very symmetrical, and it does not look like you have any issues in your eyes there. Okay? I'm looking at your sclera, your iris, your cornea, and then I'm going to take my otoscope, which is a big word for my light feature. I'm going to place my otoscope, and I'm going to see if you have equal and reactive to light. So I'm going to turn this light source on, and I'm going to come in, and I'm going to ask you just to look over there at that picture that's on the wall, and I'm going to pull your eyelid just a little bit and make sure that you have reaction there. And I'm going to come on this side and reaction there. Now, do you see reaction? Also, the other thing that I want to make sure that I'm looking at is that you have pupillary reaction on either side. So if I do light here, I'm looking to see if there's reactions on this side. If I do light here, there is a reaction there and here. All right, the other thing I need to do is kind of look into your eye, look into the fundus back of your eye, and look at your cornea, your iris, and your pupil. So I'm going to bring this into my face, into my eye. Let's see, I'm looking at your left eye, so I'm going to put this onto my left eye. So I'll do this, and I've set it to my ophthalmoscope to 0. I'll place this on my eye, and I'm gently pulling down just briefly and coming in closely, trying not to hit you in the nose or in the eye or anything. I'm looking at the back structures of your eye. It looks really good. Oh, to be young again. And then as I'm looking in on your right eye, I'm placing it up to my right eye. And again, looking. Okay. Here in the back of your eye to look there. All right, so that is not the easiest thing to do, and hopefully I'll get the hang of that a little bit better. I'm also going to step back and check with my pen light to see if you have equal and reactive, if your pupils are equal and reactive this way. So I'm going to step back and shine the light this way and make sure that you are equal and reactive on both sides, and you are. All right, the next thing is the 6 cardinal views of gaze, and this is looking at different cranial nerves. And what I'm going to do is I'm going to show you, you're going to follow my finger into 6 different areas, okay? So first here, and then up here to the right, down, over, up, back over to the middle, and then I'm going to come in towards your nose, okay? And you'll look about 5 to 6 inches from you. Okay, very good. So your 6 cardinal views of gaze are wonderful. I looked at your ocular motor, your trochlear, abducens, nystagmus, convergence, accommodation. The next thing is to look at the visual fields of confrontation. And how I do that is I will place my hands on either side, and you'll tell me when you are not able, or when you are able to see it. Okay, so here's my hands here. You'll tell me when you're able to see my fingers. Now. All right, and I'm going to do it again. And if you'll say, okay, and this way. So posterior. Okay, so I'm doing it high and low on either side, and then in the middle as well. All right. So that was the visual fields of confrontation, and I looked at all of that as well. So then I need to look at the fundoscopic, which we did do that. The fundoscopic, I looked at your left eye, your right eye, and then if we were able to also dim the lights, which I can dim the lights as well really quickly. And by doing that, I can also look into your left eyes to see if there are any reaction, which we do have reaction on both sides. I'm going to turn the light back on. Alrighty. Now I'm looking for the red reflex, and with that, I'm going to have you follow in close to the patient, and this red reflex will help me to look at your optic disc and look at your blood vessels and your back behind your eye. So again, if you'll, let's see, right arm. All right, and I'm going to look in here, and there I see the red reflex. It is very good. It's very interesting. Didn't think I would actually see that, but I did. All right, and I'm going to see it on, there's a red reflex. Very good. That is interesting. Okay, very good. So I use safety with my ophthalmoscope, making sure that I did not place that ophthalmoscope close to your eyes to hit them or to damage your eyes in any way. So that's something else to keep in mind. And I looked at your blood vessels and your optic disc, and your also inspected the blood vessels behind your eye. So let's see. I know that I'm going to do your eye exam, so I don't know when I'm supposed to do that. Okay, so Natalie, if you could, remember I told you about the two strips here. If you could stand up and stand at that strip there, that is 6 feet apart. Let me make sure that you are in our visual field on our video. Nope, you are not. I'm going to turn this slightly. Okay, oh gosh, okay. Sorry about I wish I had a videographer, but I don't, because my son is asleep. Okay, and I have the wall chart, the pocket chart. And I'm going to ask you, Natalie, to cover your right eye. Just cover it, there you go. And if you could read for me the line right here.
O-L-C-F.
Very good. Could you read the line below it?
D-H-J-B-S.
And oh goodness, let's see if you can go to this.
E-P-T-Z-O.
All right, how about this one?
C-F-D-H-J.
All right, and help go all the way down to the bottom.
L-T-F-F-M.
Very good. Okay, if you'll cover your other eye now. Very good. And we'll just start with this one down here.
L-T-F-F-M.
Man, it's nice to have some good eyesight. So Natalie, you did very well on that. I was able to inspect one eye versus the other eye, and then both eyes, if you can look with both eyes, looking at this line right here, would you read that?
L-T-F-F-M.
Very good. It looks like you do not need any glasses. You've got 20/20 vision, so if you'll take another seat there. Very good. That's good to know. All right, let me move our video camera one more time. You are doing a good job. Okay, there we go. Okay, so now we got the video camera moved, and we've done the eye exam and the head exam. The next exam is your nose. So I'm going to inspect your nose, palpate your sinuses, and then I'm going to use I got to change my my scope here, and this is a clean application for you. I'm going to inspect first and palpate your nose. And so I'm going to look at your nose, inspect it, see if there's any bumps or bruises or any pain. Do you feel any pain there? I'm going to turn the light on here, and then I'm just going to gently pull your nose. If you can lift your head just a little bit, pull your nose up there and insert this into your nostrils, and I see that you have a little bit of clear discharge there. It looks pink, and there's nothing in that's occluding your nares or your nostrils, so it looks good. And then I am going to, I know that I've already inspected your sinuses, but just for safety of making sure that I'm accurate in my inspection or assessment, I want to again make sure that palpate any sinuses to see if there's any pressure. Do you feel any pressure or pain in that area? Okay, very good. All right, Natalie, so I have here a little bit of a smell test for you. And what I'm going to ask you to do is you close your eyes and then occlude or cover one side of your nostril. Can you cover? All right, and see if you can smell that smell. Yes, and do you know what that smell is? It is a peppermint smell. That's right. Could you close your eyes and occlude that side? Very good. And do you smell that smell? Very good. It's a minty flavor. In fact, I really like that. So put a little bit off in there. Okay. So we've done the smell test, inspected and palpated your nose, palpated your sinuses. I noticed that your nostrils were pink, slightly pink, just a little bit of clear discharge, but that's mostly normal. And looked at your turbinates. I'm also looking, when I did look in there, I was looking for any septal deviation, and you have a nice symmetrical nostril nose. Okay, so the next area, okay, so then I've got to go back and, okay, so this is the otoscope gross hearing test, and I'm looking at, what I'm going to do now is called the whisper test. So I'm going to come over on this side of you, and I'm going to ask you to occlude this ear, or cover, and I'm going to whisper to you. Do you know what I said?
Apple.
Okay, and then I'm going to come on this side. You'll cover this ear, and I'm going to whisper baseball.
Baseball.
Baseball. Are you able to hear with both of your ears? Very good. So that the next step is called the Weber, and this tests for conduction in your ears. So what I'm going to do is I'm going to place this, it doesn't hurt or anything, I'm just going to place this on your forehead, and you'll let me know if you're able to hear it in one or both ears or just one of the ears, okay? So I'm going to, I'm not sure how to do this. It says just to hit it. Do you hear that in either ear?
Yes.
You do, okay, very good. And then the next test is called the Rhine test. This will be placed first behind your ear. You'll tell me when you don't hear it anymore, and then in front of your ear, and you'll tell me when you hear, if you hear it, okay? So again, I'm going to strike it. Not sure if I'm doing that correctly. Okay. Place it behind your ear. Do you hear anything?
Yes.
Tell me when you don't hear it.
No.
And then place it in front of your ear. Do you hear?
No.
No? Okay. All right. And then I'll do it on this side as well. I'm going to strike it. I'm going to place it behind your ear. Do you hear anything there?
Yes.
Tell me when you don't hear it.
No.
And then I'm going to place it in front. Do you hear anything?
No.
All right. So that is called the Rhine. So Weber's test and the Rhine test using the tuning fork. Now I'm going to do a little tug test on your ears to see if there's any pain or infection. Oh, the Weber's test tests for air conduction in your ear. So air conduction is has more flow than bone constriction. So I'm going to look in your ear, kind of pull a little bit, just a tug on your pinna, and I'm going to look to see here if I see any redness or if there's any pain. That would indicate infection before I got started with really looking into your ears for our assessment. I'm going to do the same thing on this side. Pulling, just a little tug test, pulling up a little bit, see if there's any redness or pain. Have you got any pain or anything when I'm pulling there? All right, very good. I know you were a swimmer too, so I know you've got a lot of hearing issues or pain, but not right now. So The next step is just to look inside your ear, and when I'm doing that, I'm looking for any discharge or any fragments or anything like that. So I'm going to go back with my little scope. I'm going to look here, pulling up a little bit, pulling up and back, and I don't see anything red, which I'm glad. That's good. Glad we had this now, so I can take a peek at your ear more often. Okay, nice and clean too. Proud of it. Okay, very good. All right, so I've looked in your external cavity, your tympanic membrane, looked in the cone of light, any landmarks, and then just to make sure that when I am doing this, I am holding my scope with my hand so that I don't lose, and I'm pressing against your cheek, so when I'm looking, I don't lose my scope into your ear. That would be painful. So making sure that when I am inspecting you, I'm doing it very safely. All right, so Natalie, the next section is the mouth, the throat, and the face, and I'm looking at your lips, your buccal mucosa. I'm going to place some gloves on here, and I'm looking at your salivary ducts and your denture, your dentation, not dentures, you don't wear any dentures. And so what I'm going to do is I'm going to ask you to open your mouth and stick your tongue out and say, ah, ah, and while I'm doing that, I'm looking at your soft palate, your hard palate, your uvula, that's a little U-shaped thing that's the back of your throat. And I'm also going to ask you to stick your tongue out, and I'm going to look at the bottom underneath. I'm looking to see if there's any bumps or lesions or anything. I'm looking at your gums, your dentation, all of that, your soft and hard palate. And you look like you do a good job keeping that up. And I'm looking for any deviation in the strength of your tongue. I'm looking to see if there's any, issues with your inside of your mouth. I've palpated your tongue and looked at your tonsils. So just to make sure that we got that checked off just one more time, and stick your tongue out one more time. And I'm gonna look at the strength of your tongue, see if there's any deviation either way. Good job. And make sure that I've looked all in your mouth, just make sure there's no, sorry about that. So now that I've done that, I can take these gloves off. And the next thing is to look at your neck. And one of the things I'm going to ask you to do is see if you can move your head left and right, up and down. So I'm looking at flexion and extension. Have you got any pain in your neck area or anything like that? Okay, so one of the other things I'm going to do is to make sure that you have lateral motions and rotation. I'm going to ask you to shrug your shoulders up and down. That's looking at your trapezius or your shoulder. So it looks like you're symmetrical there, and you're able to do that without pain. And you can turn. I'm going to place my fingers right here on the side of your face, and if you will turn your head to the left, and that's against resistance, and then again the other way, and that's against resistance, and you're very strong in that, so I don't have any issues with that. Now I'm going to look at your lymph nodes. There's lots of lymph nodes that I need to kind of check with. Periocular and postocular, that means in front of your ear and behind your ear. I'm going to, with 2 or 3 fingers, right in front of your ear, I'm looking for any lymph nodes that you might have, behind your ears, postocular, and in front of your ears, periocular. I'm going to look along your mandibular to see if there's any, and under your chin as well. I don't feel any lymph nodes there. I'm also going to look at your right over your clavicle area, which is right here, and below your clavicle area, right there. So those lymph nodes, and I've looked at the one that's below your chin, that's called the submental, and I did check for those, and your mandibular, submandibular, I did that, subclavicle, and need to do the ones behind your neck and then your tracheal. So I'm going to feel behind your neck to make sure there's no lymph nodes there, and then right along, and that can be kind of painful, so I'm going to be very gentle. Tracheal, there's nothing there. All right, so I want to make sure that your trachea is midline, and it does look like that is midline. So one more time, just make sure that your tracheal placement is midline. Looking at your thyroid, I'm inspecting along your trachea to check for your thyroid and all of that. And the next area is I'm going to go behind you and check for your swallowing. This checks for your thyroid. So you'll feel me behind you, and I'm going to ask you to swallow. And one more time. And I know that can be kind of painful, but should not provide any difficulty. So that just checks for your thyroid gland to make sure that things are all in check there. Looking for any lesions or anything like that. You don't obviously have a goiter, so that's not anything I need to inspect for. So Natalie, based on all of this, check to your head, your eyes, your nose, your mouth, your facial features, your ears, check for your lymph nodes and your neck. Your assessment now is complete. Do you have any other questions or concerns for me? Well, I appreciate your help as a student and as a patient. I appreciate your time, and I hope that I can assess you next time. Thank you so much.